Well, thank you, Chairman. Thanks for the organizing committee who invited me to be here and say something about Cyprus. The Cyprus strategy for the, purposely I crossed out the eHealth and I left the health ecosystem is something I believe in. And I'm going to give you a brief overview of some historical things about Cyprus, the need for reform. I'm going to stress some EU values and principles that guide and determine our roadmap towards eHealth. The patient-centered philosophy, the way we see it, some legal issues, very important legal issues, and the problems and the benefits. Then I will ask the question, can this be done in Cyprus? Will it happen? And I present the roadmap and maybe ask some questions. Maybe 2,000 years ago, some medical activity was going on in Cyprus in various forms and inventions. Medicine from wild. The Roman baths are very known for rehabilitation and keeping fit in Cyprus. But this one, you won't guess what it is. I purposely left it in Greek. If you want to see the actual description in English, you can look at it if you check on Asilos tablet. But this is, in fact, the first national health system known, at least to me. 460 years, 70 years before Christ, the king on Cyprus from Idalion hired Onasilos and his sons were doctors, and he said to them, look, you're going to treat my soldiers, you're going to treat the people here, but at a fixed price. But everybody, he was Catholic. And that what happened. Of course, he didn't have much money to give to these doctors, so he gave them land. So, national health system, the idea for solidarity was known for many years, and still so many years after, we're still struggling in Cyprus to do this. The strategy of Cyprus is based on two pillars, the horizontal pillar and the pillars and the vertical pillars. Briefly, I will mention these. First is eHealth Authority, to integrate the electronic health record from day of birth for all citizens, extending the computer information systems to all medical centers, public and private, important public and private, e-prescription everywhere, telemedicine application, big data applications, and to establish a national biobank. Pillar 2, hospital reform and autonomy, economic and management. Main hospitals to become gradually university hospitals for quality purpose. Administrative and financial autonomy for hospitals, reform of legislation for security, quality of medical care, costing of services for cost effectiveness, quality control authority, and Pillar 3, research and development, hospitals, universities, R&D centers, and biomedical companies for research partnership. Special center for administering and supporting R&D at the Ministry of Health. International partnership aiming to solutions for hot topics in health. Give incentives to health professionals to participate in such programs. The vertical pillars, Cyprus to become a pilot site for applying state-of-the-art products because of the size and the flexibility, citizen-centered philosophy for healthcare and active participation of patients, cost savings and cost minimization and maximization of funding, aiming for health to minimize illness from birth till death, homogenizing public and private health centers, full interoperability and cross-country health care, and Cyprus to become a high-caliber regional healthcare center provider, homogenizing the interoperability of public and private health centers and health professionals. Getting from EU the values for health and e-health and the social issues, we started a campaign enforcing kindly these values in Cyprus to be a Catholic system covering all citizens without compulsory contribution from all who have income. Solidarity, income-based contribution, access to all, high quality of services, secure high quality by introducing quality criteria for services. You will see towards the end, when we revisited these values, we added some more in order to accommodate some other issues realized as we were going along. Believe me, the most difficult thing to do was to establish the legal framework. It was difficult, but easy after you establish the legal framework, based on European regulations, studying the laws and revisiting and reforming the national laws. European directives were taken into consideration to be proactive and making the necessary preparation for conforming to the directives, and we took measures for converging towards these directives. Still, the main problem today is the lack of adequate and necessary legislative framework and the lack of legal certainty and moral rules, and then the barriers to progress remain, but this is not something you impose the first day. It's something you cultivate. It's something you educate people. It's something you make as part of living. I said, eHealth is not something you do, it's something you live in. So you have to prepare. Proactively acting, Cyprus introduced two important laws in addition to the others. And I'm going to mention this one, the establishment of the Protection of Patient Rights Law, and very recently, the groundbreaking legislation which passed recently and involves the patients in the formal consultation process for decision-making in the health sector. So officially making the patients, the citizen, as part of the process. This is very important, and the patient organizations felt very, very happy about this, willing to participate and believe it. If there's a legislation to pass, and you see the patient officially participating in the parliament when the decisions are made, believe it, this is it is working. Cross-border healthcare in Europe, again based on these directives and law, we reform and establish our legal framework for cross-border healthcare facility, and then we put the question, how to ensure that Cyprus participates in cross-border healthcare. We made big efforts for that. Recently, we participated in the CEF initiative. We used all the means to convince the ministry to participate, not to be an observer, to actively participate. And we secure this participation by putting the university up front and supporting constantly the ministry. And we are now preparing and updating the cross-border healthcare law for accommodating the relevant issues, and this will be submitted very shortly in the Parliament for voting. So we took the cross-border law and we reformed that instead of introducing another law. That's one other, I would say, trick we used for passing the things we wanted and we believed they were right. Is it time to change and achieve a citizen-centered philosophy? The problems and benefits for health, can this happen? Will this happen? So there is a reform, and we have to, at least we open this road for reform, hoping to get there. In spite of the warnings we've been receiving from the experts, as the experts' warning, and the related articles written by academics, we have not made the big jump yet. Until recently, when there is at least a serious political willingness and determination by the President and the Minister, officially announced and took actions. And my appointment by the President is related to this initiative. All the other ingredients, technology, personnel, people, willingness is there. So we are on our way. Before we do this, we had to work for about a year just understanding what is the roadmap. And the first thing we wanted to do, we realized we have to do is to, as I said before, is to establish and legislate the electronic health record in Cyprus. Without the record, nothing can happen. No interoperability, no universal coverage. And adopt the EU recommendation for cross-border healthcare. Update and certify hospitals and health centers. Turn public hospitals into cost centers. Encourage competition and initiatives from private sector. Make the state responsible for quality control and regulation, and appoint a regulatory and control committee. Health care providers should not be state employees. Should have state is the controller, is the regulator, is controlling quality. So they should not have, they should not be state employees, those who provide the care. And educate people, because as I said, it's a philosophy and a way of life. You see, the values, we turn them into actions, to do. And to achieve the values, you must take certain action. Taking this into consideration, it took us about a year to put down things, because in a small country like Cyprus, one can see many reasons why should not only participate in this initiative of Europe, but play an active and pioneering role. It's small size. It's an ideal place for running many pilot actions for testing and operation and applicability of eHealth at national level. A country that is visited every year by people counting 3 or 4 times higher than its permanent population should offer interoperability and cross-border healthcare services for remaining competitive at the international market. We don't do it for the locals, we must do it for those visitors. We have this obligation. The cross-border access to electronic health records of the visitors is a cornerstone for personalized health, which at the same time we provide to the Cypriot traveling abroad the corresponding benefits. And how can we upgrade our tourist products and remain competitive without expanding horizontally? By offering these services and expand to conference tourism, sports tourism, etc. It has become clear very early that we should emphasize the vehicle in electronic technology of eHealth is going to give the solution. We must start from there. The electronic health record, we call the electronic citizen record. We understood the differences, and we remain in the fact that the record goes first. The record is the beginning. Currently, we have Nicosia General Hospital is computerized, and the Famagusta hospitals, but we wanted to harmonize the private hospitals and the clinics by adopting standards for implementing the electronic health record, and at the same time do university research just to bring the ideas, show applied research for implementation. And we in fact participated in a number of EU-funded projects and locally funded projects that paved this road with few projects. I'm just listing a few here. Now, in October 2006, in the two general hospitals in Cyprus, Nicosia and Famagusta, only these two, we have an EHR integrated healthcare information system with whole structure EHR, but this is locally administered. We don't have integrated national system in place yet. But what do we do have? Legislation for the integrated national health system is currently in the Parliament for voting. It's been submitted about 15 days ago. Legislation for the hospital reform and the autonomy is currently in the Parliament for voting. Software for the information system implementation of the General Insurance Organization, just awarded 9 years after its announcement, 9 years after, and just been awarded. It's a big, very big step. Of course, the following slides and just show the significance. The cost, especially in Cyprus, is very high going out of the pocket of the citizens. If you see these slides here, in Cyprus we pay enormous, Cypriots pay, the citizen is covering from out of pocket the biggest part of the total cost. Private spending is 2.5 times higher than the EU average. We have no hope if we still in this. Spending in public sector is growing. Spending in private sector is growing. The GDP is not growing as fast to catch up. So there is no viability, for sure. So now I give you a summary and our proposition. Few steps, what to do. Of course, think. Get rid of this. From paper to digital. Understand and live the patient-centered philosophy. Have everything, everybody connected. Base the electronic health record on the fundamental patient summary and the detailed summary, the patient summary based on the EPSOS guidelines, as we all know and said and seen many times, and we introduced the extended electronic health, which is not officially approved and based and accepted at the European level. Locally, we did this. The last 3 years working on it. For every specialization, pathology, cardiology, neurology, we developed a minimum summary required to be part of the electronic health record accepted, and in the law, it says that the record, electronic record, is formed by the patient summary based on EPSOS, plus the various specializations as directed by the minister. So the minister can, by law, determines what amount of information should be kept by every specialization, by every doctor who, by the way, who wants to practice in Cyprus must have at least a minimum facility for uploading and downloading from somewhere the electronic health record with the permission of the patient. The citizen becomes owner of the data that concerns them, with the capability of the system to store medical data from different sources and specialists, store medical data from medical devices, access from authorized personnel when needed to this data. The transfer philosophy from the existing hospital to or clinic owned to the service-oriented citizen owned. Every health center or citizen has the option to choose. A unique account for every citizen is created with the first visit, the latest, with information maybe as early as 9 months before birth. So by the day a citizen is born, the gynecologist is registering the citizen in the national registry automatically and gets a record, and part of the mother's electronic health record is transferred to the newborn. Each time a citizen visits a medical center, his or hers is updated accordingly. Access to the medical data is permitted only after the authorization or the consent of the owner, and the medical data can be used for clinical trials and research after a consent of the owner. So we have the operation going like this. We can establish a country cloud for having all the records connected and accessed. And the proposition for handling the EHR data bank is as follows. Give rights to access of the full EHR of each patient to health professional. Input by the citizen himself relevant medical data. Audit trail about who else has access. Must know. The citizen must know who has access to the data. Provided that a written consent is secure, then you can use these data for cohorts, clinical studies, etc. So we reform our pillars for our general integrated national health system to be Catholic, as we agreed, mutual guarantee, access to all, high quality of service, plus to be economically viable, secure financial viability and sustainability, and establish in Cyprus by law the eHealth authority will take care these activities for implementing and monitoring at least the electronic health record activity. The pro-reforms which needed and already been done, agreement and consensus by all political leaders. So the leaders, the president called them, and they made an announcement like we made for the national problem. And they agreed on the principles. So that when they go for voting, they will vote. Autonomy to all hospitals, reorganization of the primary care, reorganization of the Ministry of Health, establishment of university clinics and hospitals which were not in existence. Full adoption of eHealth, a strategic partner for health. So eHealth for health. Establishment of a national pharmaceutical authority. Make operational the National Health Insurance Organization. costing, initial contribution from the government. How much do they have to come up with? The annual cost per citizen, the savings, you know. If you add this up, you make, there will be a surplus, believe it. Spending for health is not expenditure, it's investment. We made this every day an effort to learn this and believe it. We don't spend in health, we invest. We tell them every day the story, and I think at the end they believe it. Of course, we are a bit late, but it's a whole. We've been waiting 3,000 years. Now is the time. If you don't write it down, it hasn't been done. And I took a part from Eric Stobel's book. The patient will see you now, doctor. Thank you very much.
Thank you.